I'm Nancy Kane from Harvard School of Public Health. Nice to see you all. A very entertaining discussion. I have a question about the court's ruling that states cannot be coerced into expanding their Medicaid eligibility standards and coverage. And that is that I am assuming that means that if you're a low income and you would have been in one of those expanded Medicaid products, now you go on the exchange and get the 100% federal subsidy of your private insurance. And is there something I don't quite understand about that? And I guess if in fact you're low income and you go into the private health insurance and get subsidized instead, isn't this kind of just expanding the private insurance and sort of privatizing Medicaid, and is that a good thing or a bad thing?
So the way the law is written, the folks under 100% of the federal poverty line are eligible for Medicaid and are not eligible for coverage through the new state exchanges. So unless the federal statute were rewritten, those folks in a state that doesn't move to expand coverage are out in the cold. There's some funny business with the folks between 100 and 133% of poverty, but let's not go there for a while. The vast bulk of folks will not be eligible, which is one reason why I think, unless the statute's rewritten, there will be a huge amount of pressure on governors and legislatures from within those states to move, and to move quickly, to get into this in spite of the rhetoric, but they have to get past November 6th before they can really say that, or else it looks disloyal and like you're endorsing the law, which they can't do. But so I would expect it is going to move, and otherwise those folks are left out in the cold, and that's a huge number of the neediest folks in our society.
Wendy, did you have something to say?
Well, I think it's another example of where there was more concern for the states than there were for individuals, because they let the poor and the disadvantaged out in the cold. Now, of course, states, the expansion stands. The question is really whether the Secretary of Health and Human Services could impose the most radical penalty on on the states who chose not to adopt the expanded standards. And the Secretary cannot terminate all the state's Medicaid funding if they decide not to accept the expanded eligibility. And so you're probably right. In the long run, I would think people would want to take the deal, but in the short run, right, it's politically expedient not to, but it does harm. One of the arguments of the opponents to the ACA was that this was the use of Medicaid, expanded eligibility, was an integral part of the overall act, because people would be expected to be covered under Medicaid up to 133% of the poverty line, and then the others would be able to purchase between 100% of the poverty line and 400 with subsidies. And then so they were right about that, but pulling the penalty, I don't know how it's going to affect them in the longer run.
Any other questions? Yes, in the back.
Hi, Matt Gilman, Harvard Medical School. I'd like to ask Wendy Mariner to read John Roberts' mind, and then ask Bob Blendon what the political ramifications are. Because some people would say that he saved his own institution, but maybe set up the Republicans for an advantage by narrowing the Commerce Clause and calling the penalty a tax. So I know you can't actually read his mind, but I wonder if you could just talk a little bit about where you think the court is going, and then Bob, talk about where you think the ramifications politically of how the opinion was stated.
Well, in many respects, the dissent by Kennedy, Scalia, Alito, and Thomas reads like a majority opinion that lost its fifth vote at the last minute. Paul Campos argues this in Salon, I guess, and persuasively. First of all, if one were to uphold the mandate as a tax, there is no need to address another constitutional question. It's gratuitous to make the argument about the Commerce Clause. They clearly wanted to make it, and perhaps that was the original decision. Who knows? I have refused to speculate about this from day one. because I thought there was a textual hook for opponents to the ACA with respect to the mandate being called a penalty. And they took it on the Commerce Clause. The tax question, it's clear that Robert said, well, we should find, if at all possible, a way to find something constitutional, if possible, because we have a co-equal branch of government that said that. But it's clear that he does this grudgingly, and who knows why. Maybe he did not want to be the Chief Justice who struck down the most important piece of social legislation since 1965, perhaps, certainly in an election year. I have no idea, and I refuse to speculate on these things, but it reads oddly.
What would be the practical consequences? I mean, just to follow on from the questioner here, the kind of cases that could potentially be affected by this reading of the Commerce Clause going forward, how widespread might the impact be?
Well, there have been many arguments that a limitation on the Commerce Clause could bring down a great deal of federal legislation. It's not clear to me that it will affect a dramatic number. We will still be able to have an FDA and an EPA and an OSHA and all of those because they are affecting things that are already engaged in commerce. The premise of the limit was that Congress could not force people into commerce who were not actually participating, but could only regulate commerce that actually existed. You see, it's simple. Constitution is supposed to be very simple, just apply the law. The decision is, but I do think they've drawn a pretty hard line about engagement and did not buy the argument pressed by some of us and restated very nicely in Justice Ginsburg's dissent on the Commerce Clause, that the connection between health care and health insurance is that health insurance is, in effect, really simply a payment mechanism and not entering the healthcare system. Self-insuring, if you will, is simply another way. Economists understood it, but Robert said, we don't care what economists say. We're talking about the law.